Welcome back. A growing problem is filling emergency rooms in West Michigan.
Healthcare advocates say that beds in psychiatric hospitals are severely limited in numbers, so much so that the Michigan legislature is now looking into this problem.
News Channel 3's Colin Roos joining us live in the studio tonight to explain what they're calling a crisis in the making. Colin?
Jess, the House Subcommittee on Public Health and Food Security spent the afternoon talking to mental health professionals who say the families they serve are living a nightmare. Many are driving hundreds of miles and waiting days for adequate care, with others forced to wait in crowded emergency rooms. House members say mental health isn't treated the same as physical health, and they're ready to change that.
Every individual with a mental illness deserves access to appropriate care, not a jail cell.
When someone faces a mental health crisis in Michigan, there are few places to turn. That was the theme at Tuesday's hearing, with psychologists, parents, and counselors telling lawmakers care deserts are a persistent problem. They testified some areas of the state have less than half the recommended psychiatric beds, around 10 per 100,000 people. Those who go without them often face emergency rooms unequipped for specialized treatment or face repeated conflicts with law enforcement.
We're paying for 6 months of jail time when we could, have paid for 30 days of treatment. And then somebody would have actually got the help they needed.
One potential solution mentioned during the hearings are crisis stabilization units, or CSUs. Earlier this year, the state spent $56 million to build several more, including one in Kalamazoo. They're intended to be 24/7 centers where a team of psychiatric providers can solve crises related to both internal and external stressors. The Behavioral Health Crisis Center at Trinity Health Grand Rapids even takes walk-ins.
Maybe somebody is hearing voices, maybe somebody is feeling suicidal, they're having a lot of depression or anxiety.
The problem is that CSUs aren't always a long-term solution. Patients can only stay for 72 hours, and more than 10% need longer treatment at a psychiatric hospital after their stay. Malone says even in Michigan's second largest city, inpatient care isn't guaranteed.
When we were searching for inpatient placement for some folks, and every bed at every hospital was full.
She says people have to be connected with the right care at the right time, with consistent providers a hospital emergency room can't provide. It's a problem she feels will find a solution when lawmakers see the crises patients endure every day.
When legislators truly understand the barriers to folks getting the care that they need, that's something that's valuable within the whole system.
Now, today's meeting is the last one the House Subcommittee on Public Health plans to hold on psychiatric beds after several months of testimony. They will now work on a report with recommendations for how to increase bed capacity. Live in the studio, Colin Roos, News Channel 3.